UD3 in 5.8. Care management, in particular how people are documenting who's on the care team. And then I wanted to add some additional information on how you can stay up to date on what's changing in NextGen, both through us, of course, but also through some other resources. So with that, let's get started with clinical guidelines. So I'd like to talk a little bit about who's using them and how. And we will have a poll later on, in particular about whether people have loaded Care Guidelines 1.0. That's a new version, and I'll be talking a little bit about what that looks like. We'd also like to hear what your pain points are and what your successes are. In order to do that, you will need to get unmuted, so when the time comes, please do raise your hand if you have comments or anything to share in that domain. So first, I want to tell you a little bit about Care Guidelines 1.0, which, just for full transparency, I haven't used myself. It was released in spring of 2016. And to the best of my understanding, I don't think many practices have already implemented it in their production environment. But I was able to review an introductory video from a vendor that does NextGen support, and they had a pretty comprehensive review of what's available and what's changed in Care Guidelines 1.0. And so when we send out the slides after this call, you can click on that hyperlink where the word video is highlighted, and you can view that. You can also download the slides from that particular presentation to see it in higher resolution. I found the video, it's an hour and a half long, but you can watch it in high speed if you want to, if that's your inclination. And really the description of Care Guidelines 1.0 is concentrated in the first 45 minutes of that video, and the rest is Q&A. So don't feel like it's as enormous of a time commitment as it looks at first glance. So some of the highlights I gleaned from that. First of all, care guidelines or clinical guidelines, the name changes depending on what context, I guess, they're being referred to, both by NextGen and others. Had likely in the version that many of you have now, and in prior versions, not functioned optimally. Many people had some challenges with results not updating in the care guidelines. So if you ordered a hemoglobin A1C test on a patient, it might not actually update the fact that that patient was screened or tested on the clinical guidelines side, which just leads to a lot of frustration. You don't want to have to click in 2 or 3 or more places just to show that you've done something. That's frustrating and not a great use of people's time. So they developed Care Guidelines 1.0 in response to a lot of feedback from practices. In particular, some of the changes are that they do pull from the lab module, the lab module that you have that's kind of independent, that shows your results. So you should be able to see hemoglobin A1C tests, for example, there automatically based on how they're mapped through your compendium. The care guidelines can now be auto-applied by demographics and diagnosis, which means that you don't have to turn them on one patient at a time, which for many of us was a source of tremendous frustration. It's also possible to set individual reminders about orders that a given patient will need, even if they're not driven by a population level recommendation. So if you want to remind yourself or the next clinician who sees that patient to do something, if it's order-based, you can put that in there as well. And then there's broader information that's included in the template on which the care guidelines appear, including immunizations, labs, vitals, orders, and some screening questions like questions that you might want to associate with any diabetic visit, like are they having polyuria or polydipsia and so on. In terms of the requirements, it does require KBM 8.3.8 and above. I believe most of you are on compatible versions. And the NextGen Success community contains white papers on this and related topics. If you don't already have a login for the NextGen Success community, You can do that through, I guess, either through opening a ticket or contacting your next-gen service representative, and that's pretty critical because there's a lot of information there, and they're really guiding their clients to use that more and more. In the past, the user community has been the next-gen provided user community has been a little bit challenging to navigate, but apparently it's gotten somewhat better, and they are categorizing information in ways that allow you to see things that are particularly useful to community health centers, and we'll talk a bit more about that in a moment. Other recommendations, so you don't need to do a KBM upgrade to load this, but apparently some KBM preparatory work is needed in order to do a successful installation that leaves you with care guidelines in a format and with the data that you desire. And in order to know what that is, you really need to use the white paper that's released on that to prepare yourself. Because there are some known issues, and the video talks about what some of those are, you do want to load it into your test environment before going into production so that you know what you're getting into. And, you know, it sounds from the presentation like this is an improvement over what's currently out there. I've heard from at least one health center that they've simply just stopped using it because it wasn't functional at all. So even if it's moderately functional in this new version, that may be a significant improvement for you, but you have to test it out in order to know if it's going to work for you. And so with that, I'm going to move on to the poll, the clinical guidelines poll. And if you could just take a moment to answer. The question is, are you using Care Guidelines 1.0 at this point? And the options are yes in a test environment, yes in production, or unsure or other. Give folks another 30 seconds. Okay, so we have, I think we can close the poll. And Holly, are you able to see the results of the poll?
It looks like about 60% of folks voted, and of those, 75% said no, they are not using Care Guidelines 1.0, and 25% said that they were either unsure or doing something else, which I'm assuming it means that they're not sure.
Great. Okay, thank you. So for those of you who don't have it and are interested, I think it's worth exploring. You know, take a look at the video, and you'll be able to receive that link when we share this presentation, the PowerPoint. And if you need any assistance in determining whether it works for you, you know, please feel free to reach out to us. We can certainly you know, try to be of assistance in helping you get set up with the right tools for that. If you work through a hosted environment, then I'm assuming that you will need to reach out to your, if you're with OSIS, for example, to reach out to OSIS to find out what their capabilities. And we can also provide additional information on that by reaching out to them on your behalf if that's helpful. So moving on to UD3. So UD3 has a few features that I think are potentially helpful. Not being primarily an EPM user myself, some of them are have less meaning to me as a clinician, but hopefully those of you who use the practice management system will understand what this means. So essentially, one of the things that wasn't present in prior versions is a portal icon in the EPM indicating whether someone's registered for the portal or not. We had that on the EHR side, and having that on the practice management side could be helpful at the time of registration and so on. In addition, there are some new features to the recall plan for those of you who use recalls on the practice management side. On the EHR side, you can see in the inbox how many unopened tasks there are, how many PAQ items to be signed off, and how many portal messages. That count can be helpful, especially if you're reviewing, kind of overseeing staff, so you can get a sense of what the load is on an individual staff member. There's a new feature, and I highlighted this one because I thought it was particularly interesting from a clinical perspective, a new feature that allows providers to cancel an electronic prescription without having to call the pharmacy, and that cancellation is within the medication module. And finally, vaccine records from registries can be downloaded and reconciled within the next-gen EHR application. So I think those are some interesting potential features. I know that at least one of your practices is loading it into their test environment this week sometime. So if you have feedback from how that goes for the rest of the team, please do share with us. The HCCN portal has an opportunity for you to share information with each other, as well as access information that we put up there. We certainly hope that this group will be a resource to each other. Next on the agenda is care management. And so we had a question from one of our practices on where people document the care team. I unfortunately don't have any screenshots of this, but there are a couple of ways that you can do this. One is using the next-gen care management template set, and that's a template set that you access by identifying the specialty as care management and the visit type as care management, and that automatically brings up that care coordination, care management template set that has, I believe, four distinct pages, each with several panels, and it allows you to document fairly comprehensively any care management that you're doing. And then, in addition, many of you also have the OSIS PCMH template, which uses essentially the same database fields as the ones in care management to identify the team. So here we're talking about basically, who is the care manager on the health plan side? Do they see a number of specialists? Who are they, and what are their phone numbers? Is there a family member who's heavily involved in the patient's care? And it allows you to really keep in one place a lot of the key information that you might need as a care manager at the health center level to coordinate care for a complex individual. So with that, we'd love to hear what you're doing to handle care management information, and if you could share on your next on the next poll whether you use the OSIS template, the care management template set, or both, or you're not sure, or use something else. And we'll leave this open for about 45 seconds.
We'll give folks just another couple seconds to cast their vote. All right, so it looks like, again, about 60% of folks voted. 25% said that they're using the OSIS template. 75% were unsure.
Okay, thank you. With that, I do want to give you guys a chance to raise your hand to ask any questions you might have around any topic that we've raised today so far, the care guidelines, the care management, or UD3. Does anyone have any questions for us? All right. So far, I'm not hearing anything. Um, I did just get a reminder, of course, it is UDS season. And if any of you are having any issues relating to UDS reporting or have any questions about UDS reporting, if you want to raise your hand and share with the group, we're certainly happy to take those questions now. Or if you want to ask them offline later on, please don't hesitate to reach out to any of us. All right, I see some enthusiasm around the ability to cancel scripts in NextGen. I wholeheartedly agree with that. That was kind of a source of frustration. Um, all right, so I wanted to share some hopefully helpful information around how to stay up to date on what's changing in NextGen. There are a number of different resources. The first one is the NAC NextGen user group, which holds monthly calls. I believe they're on the third Wednesday of the month. And if you click on the hypertext here, you'll get to the NAC website. I'll show you that as it pulls up in a moment. And you can enter your email address by clicking Join Now. So they meet on the third Wednesday of the month. They also meet in person at the PNI conference, at CHI, and at FOMIT. The acronym for which I always forget what it stands for. There we go. So these are kind of a series of the upcoming meetings, but you'll have the link in the webinar itself. Going back to the presentation, and they share a lot of information and do a lot of advocacy on topics of interest to community health centers. They're very focused on quality reporting, on many of our requirements. So they've done a lot around capturing sexual orientation and gender identity information. One of the presentations I'd like to share with you after this call, and we'll post it on the portal, is a presentation from El Rio Health Center that they did on how they captured sexual orientation and gender identity information, and that was presented at the NAC NextGen user group. They're often, because they draw from such a large pool of health centers, they often have a health center that's particularly focused on one issue and has done some really creative work around that. In addition, as I mentioned earlier on the call, joining the NextGen Success community should be helpful. In particular, there's a chatter group, which is, I guess, just a subset, kind of not unlike a listserv, except it's web-based. And there's one that has a NAC tag to it, so that you can view, contribute to, and upvote known issues and advocate for improvements. So when there is a problem with, for example, encounter counting, or which encounters are qualifying encounters, when there's an issue with care guidelines, which health centers tend to use fairly intensively compared to the average practice because we're so focused on clinical quality for the UDS. You can upvote an issue so that it gets addressed more punctually. And then finally, there's a Yahoo user group for NextGen, which is not moderated by NextGen. And there are often contributors from a range of practices, not just FQHCs, who can really provide expert peer advice for free. It's not meant to be a vendor forum, although once in a while you can connect to someone who may have a tool that you're really interested in using. But in general, there's a lot of really good advice, especially around upgrading and specific patches and upgrades and what other people are experiencing as they're beta testing them or implementing them for the first time. And finally, of course, stay in touch with us. We're here to help, and we will in whatever way we can. As I mentioned, it is UDS season, and many of you I know are already very well positioned to be submitting your UDS in short order. I did want to raise one quick thing about the UDS, which we saw last year, which is that for those of you who are using I2I tracks, we saw a lot of practices submit their uncontrolled diabetics as only those who had an A1C greater than 9. And keep in mind that the HRSA handbook is pretty clear that it should include those who are greater than 9 or unmeasured. And in I2I, those appear as two distinct lines, so be sure you add them together before you submit them in your EHB. There are also always other questions that arise around mapping. So if you have any, give us a call, send us an email. We're happy to help address any questions you might have. Please review the auto mappings because everything that's done on an automatic basis will not take into account any particular quirks or special workarounds that your health center uses. If you use any special codes, you want to make sure that you're getting credit for that work and also eliminating any codes that don't represent what the measure is intended to capture. So
Anya,
with that,
before we move on, can we just backtrack 1 second? We did have a question come in about the care management templates. Cornerstone was wondering, of the groups who are using them, who is completing them at the organization? Is it the medical assistant while they're rooming? Do they have a care manager who's doing this or someone else? Does anyone have anything that they are able to contribute to this? Or Anya, do you have anything that might be of help?
I can certainly jump in with what I know one health center happens to be doing, although I think I invite anyone else to raise their hand if they have a different response. One health center has a care manager who is an LPN, I believe, and what she does is she completes that template when there's a transition in care. So it's not necessarily completed in real time when the patient is there face-to-face. Very often it's completed when the practice receives a notification the patient has been hospitalized in order to start the process for getting the patient back into the primary care office after that hospitalization. Does anyone else have anything to add to that?
It doesn't look like anyone has their hand raised, but do feel free to chime in if you think of anything as we move on. Anya, another question did come in. This is from Community Health and Dental Care. Question is, we have a special CPT code for behavioral health, OB, and vision services. Where do we add these?
So you would want the OB visits to be captured as medical visits. And so that, I believe, is in the general mappings in I2I. In terms of counting your total encounters, that's a mapping you would have to put in the next gen UDS mapping because I2I really only does your tables 6A, 6B, and 7. So you want to count your OB visits as medical visits in I2I, but also in kind of the portions of the UDS report that are counting encounters by payer and by gender and so on. For behavioral health, the same holds true. And vision, again, I can't remember exactly which line that goes on, but there is a separate line in the UDS, and that would need to be mapped within the next gen UDS mapping tool. And vision, unless it's provided by an ophthalmologist, I don't think counts as a medical visit. That's going to be an other kind of visit. Do we have any more questions coming in?
Nope, not
Okay. So with that, I might hand it off to you, Holly, to wrap things up.
All right. Well, you guys are getting a lot of extra time back today if you don't have anything else that you have questions on. But please take a minute to think about the stuff that Anya's covered in terms of care guidelines, UDS. We know that the deadline is looming, so we would love to discuss any particular pain points you're having around that, any successes that you've had. This group is really whatever you guys make of it, so we want to know if there's anything that you would like to talk about. So when we do end the call, there will be a very brief survey for you to fill out. I think it's only 3 questions. So we just ask that you be patient. It does take a minute for the survey to load. So please don't close out of the GoToWebinar or the tab, otherwise you will not be able to fill out the survey. But since we do have so much spare time, I'm just going to have you guys hang on for another minute or 2 to see if there's anything anybody else would like to discuss in the event that somebody has any other questions or something that they would like to talk about with the group. All right, I don't see any hands raised or questions in the box. So thank you again, Anya, for the presentation, and thank you guys for taking the time to join our call today. I will be posting the recording of the call, the slide deck, and any of the resources that Anya mentioned to our HCCN project portal in case you want to reference them in the future. And like I mentioned earlier, there will be a very brief survey that will pop up after the webinar ends. If you don't mind just taking a minute or 2 to fill it out, we do appreciate your feedback. We want to make sure that we're talking about things that you would like to discuss in these calls, okay? Thank you so much for taking the time, and enjoy the rest of your afternoon.
Thanks, Holly.
Thank you, Anya.